Hello and welcome to this presentation for the NMHNZ. I'm very happy to join you here today and talk a little bit about functional testing. So based on today's theme of identify and treat, we are going to explore the ways that functional testing can help you best identify and treat what is going on for somebody. So welcome to our introduction on functional testing options. So imagine with me that you have a patient come in and they're experiencing some fatigue, lethargy, maybe low concentration, just not feeling super vital when they're getting out of the bed, getting out of bed in the morning. Maybe they're having some mood issues, mood swings, just feeling low mood, generally not feeling very happy. Digestive troubles, maybe some indigestion, bloating, nausea, could be loose, could be constipation, and maybe they're just feeling a bit creaky, having a bit of joint pain, just generally not feeling like themselves. So what is going on? This could be digestive issues. As we know, a lot of things can start with digestive issues. Could be neurotransmitter issues. They could be maybe even missing some components that they need to make neurotransmitters, or their neurotransmitters could be imbalanced. Could be hormone issues, stress hormones, or reproductive hormones. Could be inflammation. Sometimes when our inflammatory cytokines hang out, they really affect a lot of bodily processes. Could be toxicity, anything from heavy metals to chemicals in the environment. Could even be endotoxins, toxins made by the body. Or we could have some DNA SNPs in play. So SNPs are just mutations that can take place in the DNA that can significantly affect the way that our body does things. So if we imagine that the patient comes in with all of these symptoms and all of these concerns or things that they would like to improve, where would we start? There's quite a complex picture here. As integrative practitioners, we know that there's a lot of things going on and there are different ways that we can start, different things we can explore about the cause. But if we had tested, we would have a really good idea what was at the basis of everything. If we tested, we'd know better where to start. So today I am going to explore 4 of our most popular tests with you and just give us a little overview about what each of them does and how they can really support you in practice. They will really help us identify the causes and treat them. So GI360 is a stool test that looks at microbiome abundance and gut function. Food antigen testing will explore a couple of different options, and this looks at the different types of food reactions as well as the inflammation that they can cause and how that can affect our body function. The Dutch test looks at hormones, both stress and sex hormones, as well as some other little cofactors that can affect that we'll go through. And organic acid testing looks at metabolism, the general overall function of the body. So as integrative practitioners, we know that this always oft-repeated quote by Hippocrates, all disease begins in the gut. And there's plenty of evidence to show that any sort of autoimmune disease or any sort of ongoing disease also has a component of what we might call leaky gut from time to time. So we're going to start in this place and explore the GI360. So GI360 is a stool test to evaluate the health of your gut. It explores a few different components and we will dive into those now. But first we will talk about when we might use a GI360. So when in your practice might you know that using the GI360 could provide you some powerful insights? Symptoms might include indigestion, reflux or heartburn, bloating, abdominal pain or nausea, burping or flatulence, bad breath, diarrhea or loose stools, constipation or hemorrhoids, any sort of changes in bowel function, undesirable things in the stool. So these can include blood, undigested food. Sometimes we'll see food particles in the stool. Mucus, changes in consistency, so softer, harder, and strange or undesired colors of the stool. And also sometimes we see worms or other evidence of parasites, which we are never happy to see. So what does the GI 360 measure? The first thing that the GI 360 measures is microbiome abundance. So it gives us a really good picture of the balance of the different types of bacteria and other organisms living in the gut and how they are balanced in terms of the reference of what we would like to ideally see in a healthy gut. So we'll give you a really cool little graph to look at that will make that a lot easier to grasp. It also looks at pathogens. So these are organisms that are known to negatively affect function. These can include bacteria, viruses, prions or protozoa, and of course parasites. And then it also looks at stool chemistries. So this includes lactoferrin, calprotectin, and lysosome. And those are markers for inflammation in the gut. Elastase, which is a marker for pancreatic function. Vegetable fibers, meat fibers, and fat stain. These showing up in the stool means that the body isn't properly digesting something. So they give us an idea that we could really up our digestive power and support our body to absorb and assimilate after digesting. And short chain fatty acids, which have been really talked about lately, which is a really cool thing to explore. Short chain fatty acids are really important for a number of things, including their anti-inflammatory effect in the gut. And we can also have things like white blood cells, which would show that there's been an immune response in the gut, mucus or blood. And we also look at secretory IgA, which is a really important marker of immune function. So before we have a look at the GI 360, what we want to do is go through a really cool way, an easy way to interpret this test. So with a lot of these tests, they contain an absolute abundance of information, which can be a little overwhelming if you are just starting to look at tests and explore how they might support your practice. But there's some really good basics and a really strong framework that you can use right away to give you some really great clues about what's going on with this person. And as your knowledge continues to grow and develop, you can get more in the weeds and really explore those little details that give us finer points. But today, I'm just going to explore with you the 3 stages of gut dysfunction. And this is a really cool way to interpret the GI 360 test overall. So this framework comes from a presentation given by Dan Kalish about the GI 360, and it's available in our education portal. And I think it's really useful to practitioners starting out using this test. Hopefully this presentation will be useful to you as well, but that would be a really great place to start if you would like to explore following this presentation. So this framework is the stages of gut dysfunction, stage 1, 2, and 3. And the way that this works is when we start having a minor microbiome imbalance in the gut, that's the beginning of stage 1. So stress and just general life, all of us go through this. This can start affecting the balance of our microbiome. And if this continues on, the imbalance can grow. And this will begin to start affecting organ and tissue function, which moves into stage 2. So ongoing stress creates a microbiome imbalance, affects the way that the microbiome is working together. That's stage 1. And then if that continues unchecked, we move into stage 2, which is organ and tissue dysfunction. So we start seeing things here like not enough stomach acid, the bile not working properly, and just general indigestion. We also might see things like low motility and things not moving through the gut or hypermotility, anything that is going on with the tissues and the organs in the gut. And then if this continues unchecked, we can actually progress into stage 3 dysfunction, which is pathogenic infection. So if we see a pathogenic infection in the GI 360, we know that stage 2 and stage 1 have already happened. So there's a really easy way to interpret the test. So this is a sample test of the GI360, and this is the front page that we look at. I've broken this down into 2 separate slides because they wouldn't all fit on one slide, easily to read. So we are just going to explore the first half of the page now and the second half of the page next. So this is what you'll see when you open up the front page of a GI360 report. You can see this little hexagonal graph here. And what GI360 has done is there is such an abundance of information about the microbiome that it can actually be really difficult or really time consuming to weed through what is actually evidence and what do we know about things in the gut. So GI360 has researched and made these really amazing algorithms and really amazing graphs for us to read that take into account of the research that is currently available about the gut and that we know affects humans in certain reliable ways. So this is a really great resource to hone down all of that information into something that's actually useful for your practice. And that's what this hexagonal. So these are different major groups of bacteria that we would see in the gut, and we hope that they're balanced in a certain way. It's really important to note that this graph and these little lines on the graph represent where that group of bacteria would ideally be in the gut relative to what we would hope to see percentage-wise. So we wouldn't expect to see actinobacteria and verrucomicrobia equal, for example. We wouldn't want to see an equal amount of them, but we would want them to be about equal on this graph because this graph has fit in the algorithm of what is ideal and healthy in the human gut and the spectrum of what is ideally healthy in the human gut. So as we look at this, we would hope to see that each of these little points on the line would be in the green, and that would be an ideally balanced gut, what we would hope to see based on what the current research says. So as we have a look around, we can see that starting from the top, actinobacteria, and going around to the left, Bacteroidetes, Firmicutes, Proteobacteria, these are all in the green. We see Tenericutes actually dipped in here on the far right. We see that dipped in, and then Verrucomicrobia is in green. We also have a dysbiosis index. So because they have made this really amazing algorithm, this really amazing information to help us understand, we might look at this graph and say, oh, that doesn't look too bad. But based on the other results and the other things in the test, they actually give us a dysbiosis index score based on the reference population. So what they have evaluated this test and said is this person actually has a dysbiosis score of 5, which is the highest score. So there are some significant things going on in this person's gut, even though on this hexagon, it might not look as intense. These two things can work together to help us have a better understanding. So this is the second part of the first page. And if we put on our stages of gut dysfunction glasses, what I'm going to do is I'm going to point out to you where we see the markers for these stages of gut dysfunction. So on the left here, we can see the expected flora summary, and we can see that there are some things noted that we can expect are a differentiation from what we might hope. And this is the stage 1 dysfunction, that microbiome imbalance. So all of these things on the side, they've taken note because these fall outside of what we would expect to see or hope to see in a healthy gut. So we know that there's a stage 1 dysfunction present. And then stage 2, the organs and tissues being affected. So here we've got very high lactoferrin and very high calprotectin. So these tell us that there is inflammation in the gut. And calprotectin and lactoferrin are sometimes used as markers for the presence or progression of IBD. So they can be very useful markers to show us if the person's symptomology is reflecting IBS or IBD, things like Crohn's and colitis. They're not indicative. They still need to be explored by a practitioner in reference to all of the other things going on, but they are used for that as a marker. So we see very high lactoferrin and very high calprotectin. There's definitely some things going on within stage 2 gut dysfunction the organs and the tissues being affected. And then looking at stage 3, are there any pathogenic infections? So in the key findings, we see here that salmonella is detected. And this is multiple species of salmonella, as well as the salmonella group being detected. So there is a pathogenic infection of salmonella. And we also see yeast detected, which has been differentiated into Candida. Now, we know, of course, that Candida will show up in the gut expectedly, but this result means that there's been more than we know is ideal. And so now, knowing these things, this person has stage 1, 2, and 3 gut dysfunction. So stage 1 here, the microbiome imbalance. Stage 2, we're seeing lactoferrin and calprotectin very high. We know those tissues and organs are being affected. And stage 3, pathogenic infections of salmonella and Candida are detected. So from here, we have identified what is going on and how will we treat it. GI360 has one of the coolest things that I have seen to support treatment, and we're going to have a look at that now. It's called a susceptibility test. So this test comes with susceptibility testing for bacterial and yeast markers. So this first one is to explore the most effective ways to treat the salmonella group. If you haven't seen susceptibility testing before, what they do is they actually isolate the specific salmonella in this person's stool sample, and they pull it out and culture it. So they take the particular salmonella from this person's stool and grow it in a petri dish. And then they take that specific salmonella and they test it with the commonly used antimicrobial agents. So they use both prescriptive agents, which would be something that you might get from the doctor, as well as natural agents. And then they give us a ranking of which of those were most effective in eliminating this or reducing this in the petri dish. So for me, this is the single coolest thing that I have seen for integrative testing and treating and supporting, because we know now that maybe in salmonella generally, we might use something like berberine or we might use something like oregano, but that isn't going to work for this particular person's salmonella. But we can see that grapefruit seed extract was very successful in supporting the reduction in those organisms, as well as silver and uva ursi. So this can really prevent us from having to do those multiple products to try and see that we hit things from different angles. It can really reduce the number of products that we're using, because if we know that grapeseed extract and silver are very effective, then we can just use those two instead of a variety of products, which is really amazing. And that is worth its weight in gold for me personally, because that is directly addressing what's going on for that person, can save them months and months of time and money buying unsuccessful supplements. And then we also have the susceptibility test for Candida. So we see that berberine is actually successful for Candida, and grapefruit extract is as well. Whereas uva ursi and undeciclinic acid, plant tannins, not as successful. So important to note here that the Candida susceptibility tests include things which are known to be successful for Candida. So some differences are undeciclinic acid, that is often known to treat Candida, as well as plant tannins, but isn't particularly known to treat salmonella. So the panels include things which are specifically known to treat that specific condition, which is really cool. So grapeseed extract shows up high in both. That would be a really great way to address both of those. And then maybe if someone wanted to use something else in addition, looks like berberine could be a good choice for this Candida, and moving backwards, silver or uva ursi could be something useful to use for salmonella. So really great to review that information with a practitioner or you as practitioners to make a plan based on this information. So moving forward, we are going to talk now about food antigen testing, which is really cool. And before we launch into the testing options and how the tests work, I just wanted to briefly explain what food antigens are. So the practitioners here will know, but for anyone who isn't aware, food antigens are the body's immune reaction to the presence of certain substances. So sometimes substances in our body elicit or bring forward a certain reaction of our immune system, and we really like our immune system to respond to things like pathogens, but sometimes it can start responding to things like food, and we would like to avoid having immune system activation where it's not needed. We want to save our immune system activation for pathogens that are around and for things that it would be helpful for, as opposed to our body reacting to food and spending a lot of energy and time on that. So really important here to make the differentiation between what is a true allergy and what are food reactions. So you will often hear people saying, I'm sure, that they've got an allergy to milk or an allergy to gluten. And those things could be true, but they might also be having a reaction. So we'll just explore that a little bit. So Ig stands for immunoglobulin. That is a substance made by the immune system. And there are many different types of immunoglobulins, and we are going to explore some of the common ones. So immunoglobulin E, or IgE, is what is known as a true allergy reaction. So that's the type of reaction from the body where you see things like hives, wheezing, runny nose, and even things like anaphylactic shock. IgE reactions are pretty fast. It's pretty easy typically to associate where they've come from and what the source of them was, and everyone will be pretty familiar with those symptoms of an IgE reaction or a true allergy reaction. So the only true allergy is to an IgE, is something that produces an IgE response. And then we have IgG, so immunoglobulin G. This is the most common type of food reaction. It's not an allergy, but it does produce a reaction in the immune system, which makes IgG. And IgG is the most common type of food reaction. It has an incidence of about 80% in the population in some tests and surveys, and so like the vast majority of people have or will have an IgG reaction in their lifetimes. IgA, immunoglobulin A, is another common food reaction. About 40% of people in some surveys have an IgA reaction. It's another common one, not an allergy, but it has similar effects in the body in terms of immune system activation. And we will explore now the different types of things that are measured in our food antigen testing and the way they look and the differentiation between symptoms with IgG, IgA, and IgE. So moving forward, food antigen testing, what are we measuring? So IgG, the most common food reaction, IgG is measured. And we also know that when IgG is present, sometimes something called C3d, or complement, is also produced. So the body also begins this, what's called the complement cascade. The body has an IgG reaction and also a complement reaction. Not all the time, but this can happen. And the presence of complement means that the inflammation that is caused by complement plus IgG is increased by 1,000 to 10,000 fold. So there is 1,000 to 10,000 times more inflammation caused by the combined presence of complement and IgG. So you can see here, IgG plus complement leads to inflammation. And the other things that we can measure are IgA, which is another common food reaction, as well as IgE, a true allergy, and IgG4. IgG4 is a specific type of immunoglobulin G that has a blocking action for IgE. And this blocking action means that it can actually dock to the cell sites where IgE would typically bind, and that means that IgE won't won't bind there, and it can prevent some of the reactions from IgE. So you can actually have what we call immune tolerance if you have the presence of IgE, but also IgG4. So moving forward, we're just going to have a look at how the immunoglobulins differ. IgE here, the incidence of IgE reactions in the population is relatively low, between 5 and 10% estimated. And the half-life, which is how long this component sticks around in your body, is about 2 days. So when you have an IgE reaction, the response is fairly quick, and also it moves out of the body fairly quickly, doesn't hang around. We see immediate membrane reactivity with IgE. So we have immediate short-term signs of swelling, hives, anaphylaxis, things like eczema and asthma, as well as the previously mentioned things. So it's pretty easy to associate what people are having an IgE reaction to typically. Now, IgE, as we discussed, very high incidence in the population, over 80%. We also see that this actually lasts for 23 days. And the half-life of this is 23 days. So it lasts significantly longer than that. So when immunoglobulin G is produced, it hangs around in the body for a lot longer and has effects. We see delayed, long-lasting effects with this. So it might take days to actually experience the effects of something you're having an IgG reaction to. It can be a little bit confusing to figure out what your reactions are actually to. And the signs and symptoms can be delayed. Headaches, rashes can look like IBS, even obesity can be associated to this. IgA, also relatively high incidence. The half-life of IgA is 6 days, so less than IgG, but definitely longer than IgE. And it is still a delayed reaction, is shorter term, but can have effects like digestive issues, liver issues, autoimmune issues. So now we're going to explore the symptoms that would cause us to maybe want to explore these things. And we'll just look here, we'll begin with IgE, the true allergy reaction. So things like wheezing, runny nose, rashes, itchiness, and skin problems would cause us to want to explore potential IgE reactions and identify those. Then we've got IgG, so things that can be markers to look at. Hey, maybe IgG is a component we'd like to look into. Things like cravings and fatigue, headaches and insomnia, joint pain, and muscle aches. And then popping up here to IgA, we see that the presence of things like candida, parasites, and viruses, as well as high levels of secretory IgA in stool, can lead us to believe that IgA is potentially a causal factor or contributing factor, as well as nasal congestion and constipation. And this here in purple is the combined presence of IgA and IgE. So it is totally possible to even have all of these reactions at once. So you could have an IgE, IgG, and IgA reaction to a food, in which case you'd almost definitely want to consider taking that out of your diet with practitioner support. But some things that maybe would want us to explore IgA and IgE, autoimmune disease and inflammation, hyperactivity, ADD, depression and mood swings, indigestion, leaky gut and bloating, and weight problems, something we might look into this for. So here are our options for food antigen testing, and I'll just explain a few of the differences. So Great Plains Lab just looks at IgG 1 through 4. And this test is either a blood spot or a blood draw, which is really helpful. Some people prefer a blood draw, some people prefer a blood spot. And it tests 190 foods, so really large group of foods. Dunwoody test tests IgG 1 to 4 plus complement. And if you'll remember, the presence of complement means that something is quite inflammatory in the body. So knowing whether or not complement is present can really help us decide, even if we have a low reaction, like a low level IgG reaction, the presence of complement might lead us to decide to exclude that from diet temporarily. Anyways, this test is a blood draw test and it tests 88 foods. You can, with the Dunwoody test, also include a full panel. So the full panel will do IgG plus complement, as well as IgE, the true allergy reaction, as well as the IgG4, which can have that blocking action for IgE, and IgA. So that's a really great test if you feel like there's quite a bit going on, combines all of those in one, and it's a really cool way to see it, what's really going on in the immune system in the gut there. And then KBMO tests IgG1 to 4 plus complement. So looking again at that extra inflammation complement can cause, and that tests for 132 foods. This is a really cool technology. They use a patented method to assess this, and they also provide a personalized meal plan with the Fit 132 option. So you get telling you what that person can eat, which is extremely helpful because sometimes when we look at food testing, people really stress out about what they can't eat, and this can show you that there are plenty of options still. So looking at the Dunwoody 588 panel sample, we can see here the testing for IgE, as well as IgG4 that sometimes has the blocking effect for IgE. And these green squares show us if we have what's called immune tolerance to IgE. So even if we are having, for example, almond has a moderate IgE reaction, so pretty significant reaction of true allergy. However, IgG4 is produced as well, which shows us that we actually have immune tolerance to IgE. So we might not experience as much reaction as we would with IgE because of this IgG4. However, large levels of IgG4 have their own inflammatory responses in the body. Another example here is cashew. So the response of cashew to IgE is high, but there is not IgG4 present, so there is not immune tolerance. And we also see that cashew further produces a moderate IgG response as well as a high complement response. So that's very inflammatory. We probably would like to avoid that food. Now, Dunwoody does a really cool thing in terms of identifying and treating. So moving back to, we have identified some of the foods that are causing inflammation in the body, giving us an immune system reaction. Dunwoody does 2 different advice panels about how to address the reactions. They do both a more restricted and a less restricted panel, or a more restricted and less restricted plan, so that you can decide based on the needs of the client. Maybe this person's autoimmune, has a lot of inflammation. We really want to take out as much inflammation as we can, so we'll do the more restricted plan. Or the less restricted plan, maybe if clients are finding it really hard to stick to things for any number of reasons, or we don't think that they necessarily merit the super restrictive plan because their health issues are less consequential, we would look at the less restricted plan for them. So this is the more restricted. It includes the foods that there are no limitation for, as well as the foods that we would like to eliminate temporarily. So with IgG, remember that the IgG will clear from the body in around 2 to 3 months. And so we want to keep those foods out of diet for the larger reactions until then, to give IgG a chance to stop having their reactions, stop hanging around, and then we can reintroduce them and see how we go. So we eliminate these foods temporarily, and then we can rotate these foods. So they had a lesser reaction, but still a reaction. And what we want to do is have them at a lesser rate and no more than every 72 hours, probably. But the practitioner will make the ultimate choice based on what everything else is in context. And then the less restrictive plan here, these foods have no limitation, and these are the foods that we would like to eliminate. This is a sample of the KBMO test, so you can very clearly see the severe reactions in red and the moderate reactions in yellow. So depending on the level of inflammation, the practitioner might decide to exclude just the red and orange and yellow foods, or they might also decide to exclude the mild reactions depending on what's going on. And then the KBMO food plan really helps us. We've identified now the reactions, and now we can treat by limiting those and excluding those foods. So now we're going to talk about the Dutch test, which is a really cool hormone test. What Dutch test stands for? Dried urine test for comprehensive hormones. One of the coolest things about this test is that it's really easy to take, so you don't need a blood draw, you don't need blood spot, so a really quick and painless way to be taking samples. This is considered the most advanced test for stress and adrenal hormones, and some tests also use saliva for tracking cortisol levels and cortisone levels. There are a few different types of tests. So the Dutch Complete looks at all of the hormone metabolites for sex and reproductive hormones. The Dutch Plus includes everything in the Dutch Complete plus cortisol awakening response, which is done within saliva. And Dutch cycle mapping includes 9 targeted estrogen and progesterone measurements throughout the cycle to characterize the way the cycle is happening. There's also combined cycle mapping test plus complete if you really wanted to get a great picture of what's going on with a person's hormones. When do we use Dutch? When might we decide Dutch would be a good tool to assess what's going on with someone? So when people are having signs of things like estrogen dominance, androgenic symptoms, which can include acne and body hair, irregular cycles, suspected PCOS or endometriosis, or confirmed of either of those, symptoms of perimenopause, stress, general stress. The cortisol awakening response in Dutch Complete acts like a mini stress test, and HPA dysfunction. We can also use it to assess insomnia. There is an add-on middle of the night test that can show us what melatonin levels are like in the nighttime, and that's really useful as well. What does the Dutch test measure? Dutch test looks for the adrenal hormones, including cortisol and cortisone, the less active form. Think about stress response. Think about how the body is responding to stress. Sex hormone metabolites, estrogen, progesterone, and androgens, as well as organic acids. So we look at 8-OHDG, which can cause DNA damage, is measured in this test. We also look at metabolites VMA and HVA, as well as dopamine, which can give us a good understanding of hormone levels and if that is part of the picture of what's going on for this person. Glutathione, does the liver have enough glutathione to be detoxing? And markers for B6 and B12, which, as we know, are implicated in hormone health as well as a variety of other things. B vitamins are incredibly important. Dutch sample. So this is looking at the front page, the first section, and just wanted to show you a little bit about what this looks like when you open up the test. So we're going to see levels of estradiol measured here, as well as progesterone and testosterone. So on this test, we can see that estradiol is high. So the estrogens are high for this person. And progesterones on the day of this test are quite low. They're outside of the range. So these little purple bits here are what we would expect to be a menopausal range. And the green sections are what we would expect to see in a person who is of menstruating age, who has this particular biology. We can also use this test for people who have predominantly male hormones, and then the ranges, of course, are different. But this is looking at a test that was taken by a person who has biologically female hormones predominantly. So we see that the estrogens are high, the progesterones are low, testosterone's middle of the range. And then we see here as well the cortisol awakening pattern, which is within range. So what we hope is that our cortisol should be rising throughout the day, throughout the evening. And then when it reaches a certain level, we would hope to naturally awaken. And within 30 minutes of awakening, we get more and more cortisol, and we hope that it should peak around 30 minutes after we're awake. And then following there should go throughout the day, go down. So this allows us to just be really awake and really prepared to support our day, and then it goes down throughout the day so that we can prepare to sleep again. I wanted to touch on one of the coolest components of the Dutch test for me, which is estrogen pathways. This test tells us about how we're detoxing our estrogen, which can tell us a lot about what is going on in our body. So if you see estrogen here, E1, detoxes or leaves the body, changes and leaves the body down 3 pathways. So we've got here the 2-OH pathway, here the 4-OH pathway, and here the 16-OH pathway. So the 2-OH pathway is the most desirable pathway for our estrogen to detox down. The 4-OH pathway can cause things like DNA damage because that actually goes down here. You can see the quinone pathway, which can lead to, if not detoxified properly, can bind to and damage DNA. So we don't want to have too high of a percentage of the 4-OH detoxification. And then the 16-OH pathway is more proliferative. So that can sometimes be associated to things like fibroids and endometriosis. There is a little chart on the side here. We would expect to see a certain percentage of estrogen being detoxed down each of these pathways. So 60 to 80% we want to go down this 2-OH pathway here, and we can see this person has 40, so that's a bit low, 46.4%. And then going down this 4-OH pathway, we would hope to see between 7.5 to 11%, and we're actually seeing 8.2, so that's all right. And then the 16-OH pathway, the more proliferative, we would hope to see between 13 and 30, and that one's quite high at 45%. So we're detoxing more than we would like down the 16-OH pathway. And we can explore different ways to support the body to detox down our preferred pathways. Dutch also looks at adrenal hormones. There's a lot of really cool charts. I haven't had time to go into all of this with you, but there's a lot of really cool charts to explore, and there's tons of information to sink your teeth into in the Dutch. There's tons to learn. So I'm just giving you a brief overview, but rest assured that there is lots and lots and lots to explore about how to support your patients. This is one of the cool graphs. So we see the hypothalamic pituitary axis here, the hypothalamic pituitary adrenal axis, the HPA. So we see that stress happens and it's occurring in the brain, and then it goes through to adrenals to affect adrenal hormone production. So DHEA and cortisol are affected. And this test measures the CAR, the cortisol awakening response, as well as the differentiation between cortisone and cortisol being the less active of the two, both in urine, so we see in the body at a metabolic level, as well as in the saliva at the tissue level. And differences there can lead us to explore different things that are going on for that person. So we can see here that this person has more cortisol metabolites in their metabolic in their metabolism in general, because this is in the urine here, more cortisol, the active form, and then down here we see more cortisone at tissue in the saliva. So something to explore there. And then the Dutch panel also looks at a few organic acids, which can help us understand what's better going on with this person. So we see vitamin B12, vitamin B6. These are what are called reciprocal markers. So we see these showing up here, then we might find that these vitamins are low. So these markers here, kynurenate, we see that these are above the range, so vitamin B6 may be low. And we also have a glutathione marker, pyroglutamate, which is below the range, so this person may benefit from potential glutathione support if that's something the practitioner thought fit in the overall plan. We also see dopamine metabolites and norepinephrine, epinephrine metabolites, as well as melatonin and the oxidative stress marker that we included, that we spoke about before. So this is the high end of the range. The 8-OHDG is high end of the range. So we see that there is oxidative stress and potential DNA damage occurring. So it would be good to address that. as well as the melatonin being low here. So if this person is having some things going on with their sleep, we know that that could be part of the picture. So going back to our main aim of identifying and treating, how does the Dutch help us identify what is going on and make choices about how to support this person with their health journey? So part of the really amazing thing to explore in the Dutch Plus is the cortisol awakening response. So this could be normal, could be high or low. So we've got this picture over here to show you what a low or a high cortisol awakening response would look like. So the yellow, as you see, is a range of what we might consider to be ideal. And the blue is an elevated cortisol awakening response. So you can see this person, as they wake, they have a middle of the range response. And then 30 minutes after they're awake, they've got quite a significant spike in their cortisol. So we see that they might feel things like anxious in the morning or a little bit scattered. They might really feel that spike in cortisol quite strongly. And then we see that it's still a bit higher throughout the rest of the morning, and it comes back down in the afternoon. Sometimes people also experience kind of a fall in energy through these periods. And a low cortisol awakening response. So this person in green here, this example person, has had actually higher cortisol when waking, but they haven't really experienced a peak. So they don't really get the benefit of that cortisol to support them through the rest of the day. And these are quite moderate results. Sometimes we see cortisol like quite low and quite flat down here as well. So if we know that that's what's going on with this person in terms of their energy, their mood, or if we know that their cortisol is being really affected, we would definitely want to address that as part of whatever we did for, or we would likely want to address that as part of what we did for their total overall hormone picture, because that's also related to sex and reproductive hormones. So we would want that to be part of our understanding of how to support that person. Other things we can identify: estrogen dominance. So going back to the first page here, estrogen dominance definitely could be something going on with this person, because we see that their estrogen is above range and their progesterone is below range. So the relative amount of those shows a strong dominance in estrogen. We could identify that. Sometimes people think that they have estrogen dominance, but they think they have high estrogen, and instead what they have is low progesterone. So they do have estrogen dominance, but it's not because their estrogen is high. It's because they don't have enough progesterone. So this is a really good reason why the Dutch test can be really useful, because if you thought you had high estrogen and you took something like DIM to decrease your estrogen, you might then end up feeling not any better or potentially worse if the issue was that you had higher estrogen compared to lower progesterone, but not actually too much estrogen in general. So it's really cool to look at the Dutch test and see, oh, actually, this person has high relative estrogen, but not high estrogen overall. Can also help us identify estrogen detoxification issues. So if you remember looking here, this person is detoxing more down the 16-OH pathway, which can cause more proliferative effects, things like associated to endometriosis and fibroids. And it can also cause androgen, or it can also identify androgen dominance or increased androgens, as well as HPA axis issues and nutritional deficiencies that may contribute. Now we're going to launch into the organic acids test. What are organic acids? So a lot of people have heard about the organic acids test. This is definitely one of the ones where you can have a really good overview about what's going on with a person by quite a simple rudimentary understanding of the test. But the more you get into oat, the more you'll learn, and there's so many different little nuances that can really hone in on what you would like to do in supporting your clients. So you can really get in the weeds with this one too, which is exciting. But don't feel overwhelmed by the test. There are plenty of ways to quickly and simply interpret what would be some good ways to begin supporting your client. So organic acids are derived from the metabolic conversion of things in diet, such as protein, fats, and carbohydrate. And they are also derived from metabolism of bacteria in the gut. So they are products of metabolism. The organic acids test is a snapshot of what is happening in the cell at its central energy level, at the level of the mitochondria. And the mitochondria, as we all know, is called the powerhouse of the cell. It converts food, such as carbs, protein, and fat, into usable energy, being ATP. And ATP is what makes the body function. It's what makes the body world go round. What does the OAT test measure? So the OAT test evaluates the metabolism of the body and the different processes, including glycolysis, the citric acid cycle or the Krebs cycle you might be familiar with, fatty acid oxidation, and ketogenesis. Things that the OAT test measures. So it looks at nutritional deficiencies, antioxidant deficiencies, can identify some signs of bacterial or fungal overgrowth. It looks at neurotransmitter levels by looking at neurotransmitter metabolites. It can give us a picture of what's going on with fat metabolism, and also looks at Krebs cycle abnormalities. So when you think about Krebs cycle abnormalities, you think energy. How is this person's energy functioning? How is the body producing energy at a cell level, at the mitochondria level? When might we use the OAT? I personally think that an OAT test, it has really powerful, useful information regardless of what is going on with the person. It has over 70 markers to really give us a great idea of what's going on with someone's metabolism. But some key examples of when we might use it include cardiovascular disease, and the potential of diabetes is another time to explore it. Neurodegenerative diseases. The neurotransmitters can give us a really good idea of what's going on there. Digestive disorders of any kind, so this can include dysbiosis, we have those fungal bacterial overgrowth markers, leaky gut, bloating, IBS, malabsorption and maldigestion, those nutritional markers are helpful there. Mood disorders, anxiety, depression, and stress. The neurotransmitter markers can really support us with understanding there. Chronic fatigue and low energy. So this test is looking at energy at the level of the mitochondria. If someone has chronic fatigue and low energy, we wonder how far down does that go? Is that actually at a cellular level that this person needs more support with their cells producing ATP? This is a really great way to explore where that is at the moment. And things like obesity, hypoglycemia, and hypothyroidism. So here is the front page of the OAT test, and there's a few things that we can explore. This is a really great test to know the basics about and really sink your teeth into as you continue to grow. So the front page, you can see the little H's show us when markers are high. There's an L if things are low. And we see that there are several raised yeast and fungal markers. So 1, 2, and 3, as well as 7 and 9 are high in this section of yeast and fungal markers. So we know that this person has some yeast or fungus potential overgrowth happening. Arabinose in particular is a marker for Candida, so that might be part of this person's picture. And we also see some high bacterial markers, hyperic acid, as well as DHPPA is high as well. So definitely something to explore dysbiosis potentially with this client, this patient. And then some of the other key markers, again, there are so many, but I just wanted to show you a couple today. The nutritional markers. So we have some markers here for vitamin B12 and B6, as well as B5, B2, and biotin. And we also have markers for vitamin C, CoQ10, and NAC, which is the glutathione precursor, as I'm sure we're all familiar. So these can give us an understanding of if a nutritional deficiency is contributing to what is going on with that client. And one of my favorites about the Great Plains OAT, so the OAT test that we offer comes from Great Plains Lab. This is the only test on the market that includes oxalate markers. So if you aren't familiar with oxalates, oxalates can come from a variety of sources, but if they are not able to be broken down and taken out of the body, they can have effects like joint pain, and they can store in tiny little vessels. They can end up in joints and the back of your eyes and different things like that. And oxalates, I'm sure people will know, are sometimes associated to different kidney stones. Some are oxalate based. So it's really important to know if those are hanging out in the body, because they can cause some things that we would prefer not to have. Now, oxalates can come from the inability to process out oxalate that is normally occurring in food. It can also be caused by high oxalate diet. Sometimes people get really excited about green smoothies, and they start having lots of green smoothies, but they may not be doing themselves any favor, because they could just be adding a lot of oxalates to their diet and they might not be processing those out. So they could be adding to these concerns. Oxalates can also be made by different dysbiotic bacteria and yeast in the gut. So sometimes we have a combination of those things. We've got yeast in the gut making oxalate, and we've got a high oxalate diet. We're eating lots of things like spinach, and the body isn't processing oxalate out. So this is really helpful for us to understand these markers. So here we've got number 20 and number 21 high, and we see that they're the higher level of oxalate in the diet. A really important thing to know here is things that include glycine, like magnesium glycinate. Oxalate is actually part of that metabolic pathway. So if a person has high oxalate, we would probably prefer to consider giving them a supplement that does not include glycine, because that will become more oxalate in the body. So something like magnesium citrate might be a good choice to explore in that case, and there are plenty of other options to explore as well. But if we didn't have these oxalate markers, we might not know, and we might be giving someone magnesium glycinate, which is a really great supplement and good for many things, but it wouldn't be supportive for this person. So this is a way that functional testing can really help us identify and treat the specific things going on for people. Other things that the OAT can identify and treat. So we had a look at the nutritional deficiencies that can be identified. Those are super useful, quite straightforward to identify and treat. Antioxidant deficiencies, as well as glutathione deficiency. Those are also quite straightforward. We see that this person could really do with some antioxidants, and we can support their body with that. We can also identify bacterial and fungal overgrowth and pathogens, and those are really, like, we see those markers, we can really look at how to support that. Neurotransmitter issues and mood issues, we can see those in these markers and begin to piece together how to best support this person. Fat metabolism, including blood sugar issues and potentially diabetes, we can see signs of, as well as Krebs cycle abnormalities. And remember here, when we think Krebs cycle, we're thinking energy at that base level in the body. So those are our 4 tests that we are exploring today. I'm just going to wrap us up with some different ways that you can continue exploring and learning about functional testing. We have quite a few online resources. So if you visit our website, www.fxmed.co.nz/testing, you can find information on the functional tests that FxMed offers. And there's a little practitioner login that you can get behind there, and you can get some data sheets and better understanding of how the functionality of the tests work and the nitty-gritty if you would like to explore that more. The education portal. Now, I have mentioned the Dan Kalish webinar about GI360. That's a phenomenal one. There are tons of amazing education resources in this education portal. So please, if this calls to you, take some time, sink your teeth into this and really explore. Some other favorites of mine include Dr. Kerry Jones. She's the clinical director for Dutch. She's a really fun and engaging presenter. She has quite a few seminars about Dutch, including a recent one about the cortisol awakening response, which is really cool. And she explores not only supplements and herbs that we could use to support, but lots of lifestyle things as well. So really good holistic wraparound information. And there's quite a few goodies in there. So please feel free to explore that. And additional resources, you can request our functional testing catalog. We can send you a soft copy via email or a hard copy in the mail, or both if you're so inclined. And practitioners can book in with technical support for functional testing training or test interpretations. So if you want to know a general overview about a test, you can call in and schedule an appointment with myself or one of the other people in the technical team, and we can explore what is specific to your practice and what might be really helpful for you in the work that you're doing. You can also call us to give us a brief overview about what's going on with a client, and we can explore what might be the best testing options for you to recommend to this person. And my favorite thing to do, you can book in with us for a functional test interpretation. So let's say you get the results for Jonna Sanders and you want to go through them and have a better understanding of what might be supportive and the products that we have to offer that might be helpful. And you can call in and book in a 45-minute, hour-long session with me or one of the other team, and we'll go through that with you. And that's a really useful thing for practitioners who are just beginning to get to understand testing and to build their knowledge about that. And it's also really useful if you've got kind of an interesting case that you want some more insight on. So please feel free to use that resource as well. You can email techsupport@fxmed.co.nz, or you can call this phone number to book in. Please make sure you give us at least 48 hours. We're always willing to be available as soon as we're available, but it is a popular service. So please plan that into your lead time for your clients. And other than that, thank you so much for joining us today. It's been really fun spending this time with you, and I really look forward to talking to all of you about functional testing. I hope you have a wonderful day and enjoy the rest of the seminar, and talk to you soon.